Well, good morning, everyone. Can you all hear me? Yes, okay. Well, first, thank you, Marlene, and let me thank the ICN leadership as well as the organizers for this conference. I think you'll all agree with me that the last day and a half have been inspiring to all of us nurses, and I'm truly looking forward to the next few days. Now, Marlene just gave you a little bit about Jhpiego. And obviously, for all of us, Jhpiego is important. It's an organization that has worked around the world for the last 40 years. What's important is right now, in over 50 countries around the world, 1,500 health professionals are working. They are nurses, they are midwives, they are doctors. They are working with one mission and one mission only: to prevent the needless death of women and their families. Now, how Jhpiego does this is by working very closely with governments, with nursing associations and midwifery associations, with medical associations, with nursing and medical schools, with local NGOs and the community. Our goal being to help countries develop their skills, their capacity in quality family-centered care in areas like maternal child health, HIV and AIDS, cervical cancer prevention, malaria, and many, many other areas. So let's get the context of women's health first today. What do we know about the state of women's health in the world in which every one of us nurses lives today? In the world in which we live today, one woman every 2 minutes will die due to pregnancy-related causes. And 99% of all those women are in the developing world. In the world in which we live today, 270,000 women will die of cervical cancer, a very preventable cancer. But in actuality, only 1% of women in the world have an opportunity to be screened. In the world in which we live today, 500,000 women will die of TB. Women and girls make up 60% of all HIV/AIDS cases in sub-Saharan Africa, and they make up 50% around the world. And at the same time, 7 million children will die this year, with 3 million of those being newborns under the age of 5, the size of the population of New York City. That is the state of women's health today. Now, Mahatma Gandhi once said, "Be the change that you want to see in the world." You know, I'm very, very proud to be the president and CEO of Jhpiego. But I am first and foremost a nurse. In my career, I've had opportunities to be a neonatal nurse, a pediatric ICU nurse, an educator in a hospital, a faculty member in a university, and now an administrator in nonprofit organizations. My passion, the change I have wanted to see in the world, is ensuring that women don't die needlessly. We know how to prevent women's deaths. We know how to save children's lives. That is the change I want to make, is to make sure they live. Now, this talk is based on a very old Chinese proverb that says, "Women hold up half the sky." Now, I'm sure all of you out there are saying, well, that's obvious, of course they do. But when this proverb was developed, it was radical. People responded to it because it talked about the importance of women. It talked about the power of women. Well, I would say today, we're going to talk about the power of women, about the strength of women. Look at these 4 women, all women who have made an impact on women around the world. Hillary Clinton, previous First Lady, previous Secretary of State, an individual committed to women's education and girls' education and women and girls' health. Indira Gandhi, former Prime Minister of India. A woman committed, had passionate, championed care for the poor. Liberian President Ellen Johnson Sirleaf. A woman that has dedicated herself to the empowerment of women. And Florence Nightingale. A woman that developed a new model of nursing. She believed in evidence-based practice. She believed in caring and compassion. And very importantly, she believed that every person deserved the care they needed, no matter their economic level, no matter their geographic location. These women were making social impact on the world and particularly on women. These women were being the change that they want to see in the world. And I would argue, are these women not holding up more than half the sky? Now I will show you pictures of women that we don't know the names of. You may not know where they're from. You may not know what economic level they are, what religion they are, what culture they are. But these women as well are making a social impact on their families and their communities. These women as well are holding up more than half the sky. We know that the role of women is incredible in the world, and I know this because I've had the distinct opportunity over the years to meet women all over the world. And I can tell you, having met women that are in the ministries of health, first ladies, nurses practicing out in the communities, women in local organizations, women in the farmlands, I can tell you that women play an undeniable role in this world, improving the health and the well-being of their families and of their communities. These women are truly women that are making a difference in the world. So what do we know about a mother's life? When a woman dies, the likelihood of her child dying under the age of 2 is 10 times greater. When a woman lives, the family stays intact, the community's stronger, the country's stronger, and our world at large is stronger. What we know is when a mother lives, that child is likely to get more nutrition. That child is likely to get immunized. That child is more likely to get educated, to hold a job as they get older, to be productive citizens. And this ensures that developing and fragile countries around the world have educated human capital that can support a politically stable country and an economically sound country. That's the impact a mother has. That's the impact a woman has. We know that women and mothers influence both families and societies. You know, when a mother dies, it's not just the physical death. When a mother dies, we lose the paid or unpaid labor of that woman for that community. When a woman dies, that country no longer benefits from the contributions of that woman to social and economic development. When a woman dies, it becomes critical for that country. They lose a cost. It's a cost to that nation when a woman dies. We know that women right now are economic drivers in the world. We know they make up 40% of the global workforce. We also know that they own many, many small businesses. They are the agriculture workers in many countries. We know that in the next decade, there will be 1 billion more women going in and being employed. And if they are employed at the same rate as men, we can see the GDP of developing countries go up as much as 25%. We also know that in 1/3 of the households around the world, they are being headed by women. If we want an economically sound world that benefits security, then we must focus on women's health. We must focus on maternal health. Women are also health providers. Even today, the majority of all nurses in the world are made up of women. Now, that is not to say we are not thrilled to have men in our profession. David Benton, Peter Johnson, who is our Director of Global Learning. But it is to say a reality. The reality is the nursing profession continues to have a majority of women. That is the power of women. What we also know right now is 87% of the global health workforce in the world, I'm going to repeat this, 87% of the global health workforce in the world are nurses and midwives. We often are the first point and the only point of care for marginalized women and children. We are there. That is the role nurses are playing around the world. What we also have learned is that women quite often, in communities anywhere, are suspicious. They want people that know them. They want people that know their culture. Nurses quite often are from the communities that they're working in. And women are much more inclined to listen to women. That's an important variable as we're looking at how do we ensure that women have access? How do we ensure that we do everything we can to help every woman survive that should survive in this world? Now, what we also know is that obviously I've had the opportunities to travel. I've worked in many developing countries. And what I wanted to do today is talk to you a little bit about the impact that nurses are making. I wanted you to hear what I see that nurses are doing to encourage women to have access to care that they may not have had before. Nurses are making an impact in the world by advocating for other women. Who better than a nurse? A nurse plays an integral role in the care of women and children around the world. Nurses have firsthand knowledge about what works and what doesn't work. If you ask nurses in the countries I visit, they will tell you why a child is not being immunized. They will tell you why a woman doesn't go for cervical cancer. They will tell you why a woman doesn't use family planning methods. You see, nurses so often are from the communities they're in. They understand. They understand barriers to access. They understand inequalities of gender. They understand social stigma. This is a story about a nurse, Rati. Rati lives in the northeast corner of India, and Jhpiego trained her back a ways in family planning, particularly postpartum family planning. And in comes a woman named Anita. Anita came in, and she was in her 5th pregnancy. And Rati started talking to her about child spacing. And Anita said, you know, I do have 4 small children, and I'm exhausted. She said, but my mother-in-law will not allow me to use contraception because I have to have a son. What did this nurse do? How did she advocate? How did she come up with a solution? She understood the culture, like so many cultures around the world, where women live with the husband's family, and the mother-in-law is the individual who may dictate how care is given to that woman. And so Rati invited the husband, the mother-in-law in, talked about child spacing, the importance of child spacing both to the mother's health and to the newborn's health. And as well talked about family planning, that family planning had there's short-term family planning methods and long-term family planning methods. Well, Anita had her baby, and it was another girl. And that nurse herself inserted an IUD postpartum. Rati was able to advocate. Rati was able to understand that culture and find solutions. That woman would not have had access to care if it wasn't for Rati coming up with ideas, helping her see what was important to her own health. Because Rati didn't want her to die. And at this point, having 5 children right in a row, she is very much at risk for dying, and so is her baby. You see, nurses are in a critical position to be able to advocate for women. They can be the voice of women when women have no voice. I have also seen nurses making an impact by demanding respectful care. Nurses are in an incredible position to be able to give humanistic care to women. You know, the phrase safe motherhood is not simply a phrase about women surviving. The phrase safe motherhood is about respecting a woman's human right to decide. It's about respecting a woman's human right to have feelings, to have dignity, to have respect, to have choice, to have preferences. That is what safe motherhood is about. We have learned in Tanzania that women, the predictors of women going to facilities, is not the cost, is not the transportation. It's about being treated respectfully, humanistically. We see this around the world. In Cambodia, there's a nurse named Chandra. Women will bypass health post after health post to get to her clinic because they say she cares. We see this in the slums of Kenya, where women now are accessing care more than ever because they heard there was a nurse midwife there that treated them kindly, helped them learn. We as nurses have a unique role in giving access to women by treating them with the respect and demonstrating that to them and the community at large. We have the ability not only to use our new technologies, our new strategies, our new innovations, but we have the ability as nurses to bring strength and power to this woman and respect her decision-making. Nurses are making an impact by ensuring that facilities are clean. I know many of you are saying, well, yes, of course, Leslie. But I want you to think about this. Clean facilities not only protect the woman, they protect the health worker. We know that the 3rd leading cause of women dying in childbirth is due to sepsis. When nurses learn, nurses from facilities that don't have running water, that don't have electricity, when they learn ways of washing hands, and they learn ways of cleaning equipment with solutions they can get in their own market, when they now see women not dying of infections, they are making a difference, and these women are coming back. You know, there's stories of when I travel, I will talk to mothers and say, you know, are you going to go to this facility? And they'll say, oh, yes, now I will. And I'll say, why? And they'll say, I wouldn't go before because it was dirtier than my own home. That's a respect. It's not just infection prevention. It's out of respect. In a country like Mozambique, the Minister of Health understood this so much. He understood that it's benefiting not only his nurses, but it's benefiting the people in that country. That he is expanding infection prevention to 123 facilities right now. Jhpiego will not implement any program or any intervention in the world without an infection prevention component. But you see, the importance of this is the nurses own it. They feel they own this change. When I was in Uganda, I was talking to nurses 4 hours outside the capital in an area that had just gone through this training. And the nurses and the doctors were telling me, you know, we haven't seen one infection from a C-section. And we used to have 12 a month. So you see, they're also seeing the benefits. Women will come back to access care if they hear there are benefits to that care. Women are making an impact by bringing care to the women. Nurses are making an impact by bringing care to the women. What do we know about this? We know that quite often, women can't access care. They can't get to hospitals. But we actually know what to do about that. This is a story of Rose Marie. Rose Marie is on a cart. She's having complications in her pregnancy. She will now travel 6 hours, 40 miles on this cart that is pulled by a tractor. Nurses know these stories in the low resource and emerging countries of the world. Nurses know these stories all around the world. They know of stories where women cannot, due to a variety of circumstances, access care. We as nurses need to make that impact by bringing care closer to the women. So what are nurses doing? Nurses are now, and have been for some time, looking at task shifting. They're looking at ways that we can get their skills upgraded so they can get to the care to women. In South Africa, it was nurses that recognized women and families would not be getting their ARV drugs. They understood that unless nurses started giving it in clinics. And long before the legislation changed in 2010 to allow nurses to run these clinics to give the HIV/AIDS medicines, nurses were already out there giving these medicines because they knew it was the right thing to do. In Guinea, physicians were the only ones allowed to do post-abortion care until nurses said, but I'm the one that's seeing these women. If I can get the skills, I can do that care and we won't lose a woman to bleeding to death. We have seen this with emergency obstetric care, where physicians were the only ones doing that. And now in Afghanistan and India, nurses are able to do emergency obstetric care. We have seen this with postpartum IUDs in Kenya, where nurses were not allowed to do that. Physicians were not allowed to do that, and now nurses are. We have also seen this with cervical cancer. Cervical cancer prevention is something that nurses have been advocating to do for years, and I'll talk about that in a few minutes. Nurses are making an impact by ensuring that resources are available. You know, nurses recognize more than anyone when there aren't commodities or medicines available for their women, their families. We see quite often nurses talking to us about the fact that I just got new skills and knowledge in malaria and pregnancy, but unfortunately I have no malaria drugs. Oop, hold on. My little, okay. It broke. How about that? Okay. All right. We'll just do it like this. See, we're innovative. Where was I? Oh yeah, Nurses very much recognize that a health system not only includes improved skills and knowledge, but it also requires all other elements, including resources. What I am seeing in the world in which we work are nurses talking to mayors, talking to ministers of health, talking to the decentralized system with the ministry officials in their area, talking to hospital directors, saying, you know, you brought us for training, but if you want us to be able to do this, we need to have the materials. There are countries that have standards of practice for treating preeclampsia and eclampsia with mag sulfate, but there is no mag sulfate on the shelves. There are countries that want you to offer them a variety of family planning methods, but there are none. There's one that's available. Nurses are making an impact in the health system. Nurses are advocating for what's right to ensure that women get the care they need to get. Nurses are also guiding innovations. This is one that I absolutely love, that I think all of us need to be talking about. because I will guarantee you that every single nurse in this room has innovated. You know, Jhpiego for 40 years has been committed to developing low-cost, effective innovations. Our belief is an innovation is not successful unless it is adopted and utilized. There is no global innovation that is successful if the users don't know how to use them and haven't been involved in the development of them. I want to share with you a couple of these innovations because to me, it is what nurses are doing that will benefit the world. There is one program here, Helping Mothers Survive, Helping Babies Breathe. We call it the day of birth strategy in Jhpiego. We believe that you can never separate the mother and the newborn. It's all one, and it's all in that first day. What we needed to do, and I should recognize, Laerdal Global Health has been very much the driver and the person behind this. Jhpiego had the opportunity to be able to work with them alongside other NGOs, alongside other groups. But what I want you to know about is the role that nurses have had in this discovery. What was identified as a need by nurses, by midwives, was we needed low-cost models that we could take out into the front line, that we could teach with, that would be simple, that would be effective, and that would give examples both of healthy deliveries as well as non-healthy deliveries. The Helping Mothers Survive, if you haven't seen it, it's in the booth, in the Jhpiego booth, was very much had nurses involved. Very much had nurses involved. This item, this model, this simulation model went out to countries and nurses and midwives changed it. They adapted this, revised this. Nurses have been involved in this creation. They've been involved in the field testing. They've been involved in the implementation of it now. It is nurses that play the vital role in getting these innovations into the country and out to its people. And the same goes for Helping Babies Breathe. A low-cost model. Both of these come with training manuals. Both of these come with tools. And nurses were behind this innovation. The other innovation is cervical cancer prevention. I told you 270,000 women die a year, and only 1% of women are screened. So you take a country like Thailand that was doing incredible work with pap smears over 20 years, but only 5 to 10% of all women were screened. And so it took a brave OBGYN who believed in nursing and nurse midwives, who said, number one, who's seeing the women in the far reaches of Thailand? It's nurses and nurse midwives. Number two, how are we going to create a system that works? So she, alongside these nurses and nurse midwives and Jhpiego, worked together to come up with a system that uses vinegar on the cervix to see atypical cells, and uses a cryotherapy unit, a very simple unit that will freeze if the atypical cells are there. Right now in Thailand, they have screened more than 800,000 women. That's what nurses and nurse midwives are doing with their innovations. Around the world, in more than 30 countries, nurses and nurse midwives are working to screen women for cervical cancer. And it has become more serious than ever, because with the advent of HIV and AIDS, cervical cancer is becoming more paramount. We are seeing it 10 times more than other women. Nurses are making an impact by elevating their profession. You know, all of us need to honor our profession. When I visit a country, I visit with the nursing councils, the nursing associations. I visit with the educators in the school. I visit with the nurses in the far communities, as well as the nurses in the hospitals. I'm not just doing it because we partner with these nurses, because they are part of our programs. I'm doing it because I respect and honor the profession of nursing. Any of us that are doctors are always introduced as Dr. Leslie Mancuso. It is our role to honor our profession by making sure the next line we say is, "Thank you for that introduction, I am a nurse." What I have seen in these countries is champions of nurses, nurses that have gotten new skills and knowledge, who are out there teaching other nurses. They are not simply satisfied with learning new skills and knowledge. They are champions. They're my heroes. They're out there ensuring that other nurses benefit. They are elevating the profession. I see faculty, I see others, trainers in countries, who are using mobile communication to mentor the trainees that go out there and are trying to practice. That is elevating the profession. That is something we all must take seriously, but I see nurses in the countries in which we work doing this. Now, I know that these examples may be different. They're from the developing, emerging world. They may be different than circumstances or different than your countries. But I would argue that the principles can be carried through in any country we work with. Are we as not nurses able to give women access to care by advocating for those women? Are we as nurses not able to give women access to care by advocating for humanistic care, respect of a woman's dignity, respect for her feelings? Are we as nurses in anywhere we work not trying to ensure that women get the care they deserve no matter where they live? Are we as nurses not worried about the resources that are available so that you can use the skills that you have? All of these items allow us, encourage us to ensure that women get the access to care they deserve. So how can you make your impact? Well, I would say to all of you, we live in one global world. We are one profession of nursing. As nurses, we cannot stand by knowing that women and their families are dying needlessly. As nurses, we need to look at what our change is for the world. As nurses, we need to advocate for those women that don't have a voice. As nurses, we need to demand that women and families get the care they deserve. Who else but a nurse can demand for the rights of women and their families? I agree. We as nurses need to look at what leadership positions nurses are filling. I want to see nurses filling all the leadership positions in international NGOs that are focused on health. I want to see nurses filling multilateral organizations positions. I want to see nurses in leadership positions in businesses that are dealing with healthcare. If we make up 87% of the healthcare workforce, we need to be in those leadership positions. That's how we're going to help women. We also need to recognize the importance of every single one of us. Each of you comes here today. Some of you are educators, some of you are researchers, some of you are public health nurses, some of you are hospice nurses, some of you are ICU nurses, some of you are academicians. You all come here with your skill set. We need to recognize that as one profession, each and every one of us plays a significant role to honor our profession. And we need to recognize that every component of our nursing and profession is important. I always say to students, you know, what career could you have that you can take your career in many different directions because you are an expert in health first and foremost? That is a wonderful luxury that nurses have, and we need to recognize every role each of you play in your nursing roles. We also need to raise up the women around us. There are many opportunities of us creating an awareness. I want you to think about opportunities where you could link with other women in other countries or other women in other communities and other cultures. I want you to think about how much you will learn from them and how much they will learn from you. You see, learning is both ways. I have learned so much from the incredible heroes of nurses that I have met in the 50, 60, 80 countries I have visited. This is something we can do for other women. This is something we can say about other women. Let me tell you a small story that's going on right now. We have two large girls' schools. There's many more, but we have two in Baltimore. And they approached us about learning about our organization. And so we started by telling them what's happening to women's health around the world. And these young women started and formed. They came up with ideas that we might not have, certainly ideas in social media, ideas of raising awareness, ideas of fundraising that we wouldn't have. But here was something that really moved me. A couple weeks ago, I heard one of these young women speak in front of 150 people. And she stood up in front of them and talked about what's happening to women, that women are dying, that a mother is dying every 2 minutes, that when she dies, the likelihood of her child dying is 10 times greater. This young woman stood up there and talked about that and said, we cannot rest until we do something about this. That's creating an awareness. We as nurses can create that awareness. We have the ability to find ways to lift these women up in the world. We also need to be our own advocates. We need to value ourselves and our profession. We need to negotiate our value. If we don't stand up for our value, then we are not standing up for the women of the world and the other nurses of the world. It is important for us to recognize the role we play in saving women's lives and saving families' lives and making sure this world is a healthier, safer world. And so I take you back to the leaders that you met originally. And I ask you, what impact do you want to make in society? What impact do you want to make for women and families? I challenge all of you as women to be those leaders, to take on the challenge of making the change that we want to see in the world, which is the change of women surviving. And so I say to all of you, let us go forward as nurses, from Ghana to Haiti, from the UK to Australia, from the Philippines to Chile, from Ethiopia to Thailand. Let us go forward as one profession of nurses who are out there to save women's lives and in turn create a safe, educated, economically sound world. Thank you very much. I'm now open to questions.